Hi everyone. Today we're going to discuss the topic that is a Measles. Okay. So in Measles we'll discuss definitions, causes, risk factor, sign and symptoms, diagnostic evaluations, medical managements, nursing managements, and complications. So first of all, we have to know what do you mean by measles. So measles, that is a highly contagious viral infections that is caused by a virus. The virus names that is a paramexovirus. So it's when that is characterized by like fever, rash, inflammations of the upper respiratory tract. Okay, and also fever will be there, rashes, blister. Okay, so these are the sign and symptoms, okay, will appear. So we'll see now the definitions of this measles. So measles is a highly contagious viral infections caused by that is measles virus, caused by measles virus, a paramexovirus characterized by a distinct rash and a set of systemic symptoms. Okay, that is measles. Now we will see the etiology. So etiology, the other name of etiology, that is causes. So what are the causes of this measles? That are virus. So main causative agents of this measles, that is a virus. Measles is caused by measles virus, that is a paramexovirus. Okay, transmissions, the next causes, that is a transmissions. So transmissions, how it will spread through respiratory droplets by sneezing, coughing. The infections will spread. So the next point that I told you, that is a transmission. So it spread through respiratory droplets when an infected person's cough or sneeze. It can also survive on surface for several hours. So it can also survive on a surface for several hours. So this is the causes. Next we'll see the risk factor. So what are the risk factor? We'll see here how the persons may get infected with this measles. So what are the risk factor? We'll see unvaccinated individuals. So here you can see here unvaccinated individuals. So if any persons has not taken the vaccination, so there are more chances to get infections, more chances to get a measles infection. So here you see the primary risk factor is lack of vaccinations. Okay, if uh, the person has not taken the vaccination, so more chances to get a vaccination. So which vaccinations for measles? That is a MMR vaccinations. MMR, that is measles, mumps, rubella vaccinations. So this measles, the other name also known as rubella. Okay, and next risk factor, that is young age children. Children under the 5 year, at the 5 year are at risk. The children under 5 years are more risks. And next we'll see that is a malnutrition. The other risk factor, that is a malnutrition, like vitamin A deficiency can increase severity. And next risk factor, that is a weakened immune systems. So if a person's immune system is weak, then more chances to get a measles. Next we'll see that is a sign and symptoms. Sign and symptoms, the other name of sign and symptoms, that is clinical manifestations. Clinical manifestations. The other name of the other name of sign and symptoms, that is a clinical manifestations. So in initial symptoms, 1 to 2 weeks after exposure, there will be the high fever. Okay, high fever will be there. High fever more than 37 degree Celsius. Okay, cough will be there, runny nose will be there, conjunctivitis. So conjunctivitis means we know that is the inflammation of the conjunctiva, that it's known as red eye also. And next, uh, rust will be there. Okay, it will begins after 3 to 5 days after initial stage. Okay, after initial symptoms, start at the start at the hairlines and spread downward also. Rust typically lasts 5 to 6 days. It will, the rust typically lasts up to 5 to 6 days. Next we'll see that is a diagnostic evaluations. Next we'll see that is diagnostic evaluation. So in diagnostic evaluation, first of all we have to do that is a history collections and physical examinations. History collections and physical examinations. After that we have to do that is a laboratory test. So in laboratory tests such as like here serological testing, we have to do example IgM, IgG antibodies. This serological test will do for detect the viruses. Okay. And also next we'll do PCR testing for throat swab or urine to confirm the presence of virus. Next we'll move on, that is a medical management. So in medical management, here first thing is supportive care, hydrations and rest. Next that is a antipyretic for fever. Antipyretic medications will provide for fever. And next is antiviral medications, uh, viral antiviral medications such as acyclovir. And next medication that is a vitamin A supplementations. So vitamin A supplementations, that is uh, recommend for children to reduce the complications. For reducing the complications, we will provide a vitamin A supplements. Next we'll move, that is a nursing management. So in nursing management here, first of all what we have to do, monitoring. So we have to assess the vital signs, hydration status and sign of complications. Next is isolation precautions. Okay. So isolation precautions here, like we have to implement airborne and droplet precautions to prevent the prevent transmissions. And next, educations, we have to tell about the vaccinations. We have to inform the family members about the vaccinations and importance of measles preventions. Okay, so these are the nursing management uh, of measles. Next we'll move on in complications. So what are the complications will be there? The common complications, uh, the common complications will be like diarrhea will be there, loose motions. Okay, otitis media, that is a middle ear infections. And pneumonia will be severe complications such as like encephalitis, that is inflammations of the brain. So these are the complications of a measles. Okay, thank you.